Break.
And we are live talking about preventing osteoporosis and building bone density.
That's right. We've got a lot of good information on if you're at high risk for it, and how you treat it. We're going to touch a little bit on medications and diet, not too much. We are also going to hit heavily, naturally, on exercises because that makes a big difference in regards to over the long term. If you start exercising at a younger age, you have a better bone density and will carry over as you get older, so you have less risk of it. Dr. Adrienne is here today, and she is more of an expert on this than anybody here, so she's going to give us and you some wonderful advice and information. What do you have to say, Dr. Adrienne?
I'm glad to be here, and I love talking about osteoporosis, especially, like if you treat it beforehand, right? Or like you start exercising young, you're going to build that bone density and reduce your fracture risk for life.
There you go. Yeah, the fractures with osteoporosis are most prevalent in the spine, like the low back, upper lumbar, and hip fractures. That's how a lot of people find out they actually have osteoporosis. And we want to talk a little bit about how you can find out beforehand and what some of the symptoms may be.
I do want to mention that we give something away every week at Bob and Brad. So if you saw that imagery before this part on screen, that's what that was showing, how to sign up for our giveaway.
Did they have a picture of the hand spa?
No, it was just how to sign up for the giveaway. We are giving away a Hand Spa Prime hand massager this week. You can sign up for the giveaway at bobandbrad.com. I have it on right now, so when it cuts to us, you can see what it looks like. It kind of looks like the glove mascot from Hamburger Helper.
Oh, I kind of agree.
Yeah.
It needs a big red nose, though.
Yeah, actually, we've had a hand massager for 2 or 3 years now, and this is our, I think, 3rd edition, and they continue to improve it every year. Every time they come out with a new one, it's a little more improved. This one has individual compression on the fingers, the palm, and the wrist. So it's 3 compartments, and that rotates the, depending on what mode you're on, how it will actually compress. And you do it what feels best for you.
I want to mention that we also are having a Valentine's Day sale right now.
Oh,
you
yeah.
can get 15% off of select Bob and Brad products on our website at bobandbrad.com. You have to use the code LOVEYOURBODY.
Yeah, and if you're considering flowers or something like that, that's just fine. But one of our gifts are going to way more impress anybody than those flowers. You can buy those anywhere, but you can't use flowers on your hands or the massager.
Well, and they die after a few weeks. So.
Well, I get the plastic ones; they last forever.
Oh
yeah.
You got to get ones with roots so you can water them and care for them.
Yeah. I don't have a green thumb, and my wife knows it, so she understands.
I think a fun fact about Adrienne is she might like to get some weird type of bug for Valentine's Day because she collects bugs.
I don't collect bugs. I just enjoy bugs.
What is the name of a bugologist?
You're putting me on the spot. It's an entomologist.
Oh. Entomology. So if you like entomology, we've got something in favor in common with Adrienne.
Brad, you're spinning on the image right now.
Well, that happens, Once you get to a certain age, things happen. You can't control it anymore. And I don't care. My filter's starting to go. You guys will notice that occasionally, but my sister never had a filter. She says whatever she wants all of her whole life, and it's kind of entertaining.
Well, at least you had one. We got some people tuning in already. Want this file in PDF. I don't really have
let us know where you're from, your name and where you're from.
Ooh, Michigan, 40 degrees today.
Arizona. Hello, Parrish. Yes, I don't know if I'm saying that. Good morning, everyone. Love your Theragun. Well, thank you. Morning from Chico, California.
Chico.
There's Diane. Diane, I recognize Diane. She's watched before. Love your hand massager. I purchased recently. Oh, good.
Mike's wearing it right now.
Yeah,
so
I just tried it too. It is nice.
Yeah, we got the UK, Wendy.
Excellent. All the way across the pond.
West Jordan, Utah. I've been to Utah once, but not West Jordan. Hi, Val.
Oh, St. Pete, Florida. Did I see?
Yeah.
Dublin.
Yeah,
Ireland.
we're going there. My wife and I. Maybe we'll see you next month.
Well, our intro song's coming out.
Oh, yeah.
Bob and Brad, the 2 most famous physical therapists on the internet.
We're gonna have to get the intro song to say like 4 famous therapists on the internet or something soon.
Yeah.
Hi. Anyway, we're in the Hands Bob Prime here, which we are giving away this week. So you can see it. It is currently massaging my hand, and yeah, you can sign up for the giveaway at bombbrad.com.
Very good.
pretty
Yeah.
nice.
I'd like to formally introduce Dr. Tryon. Why don't you stand up and say hello?
Stand up. Hello.
There we go.
Yay,
Right.
round of applause.
And,
Glad to be here.
and she had already mentioned she is the foremost expert here on osteoporosis. She's going to offer some really good information. And, Mike and I will do fine as well. But the more information you can get, the better. Anyways.
Yeah, we did our research.
Oh, absolutely.
Yeah, we can read stuff.
You bet. So osteoporosis, I'll start, and then you guys can come in as needed. Usually over 50 years old, there's a chance that you have mild form of osteoporosis. And osteoporosis is the density or the integrity of bone starts to decrease. And it's not a real big deal if it's not decreased too much. But as you get older, women have more evidence of osteoporosis, evidence, not the word, more prevalence of osteoporosis than men. The information I found, 1 in 3 women over 50 will have it. 1 in 5 men will have it. And there is a good reason for that. Adrienne, you want to explain that?
It's really the loss of estrogen in menopause. Estrogen is kind of bone protective. And so when you lose that, women usually lose a lot of bone density. So taking steps when you are, premenopausal, perimenopausal, or even during menopause is really important. And the steps that we're going to go through today are just basically exercise. So resistance training, and lifting weights, and even doing some things, if you're higher level, such as hopping, can be really important. And just basically, it's got to be progressive, right? You got to keep loading tissues over time.
Right.
So
And we'll demonstrate that
Yep.
when we get into that section. And she did mean hopping. So it's interesting because that puts a little more stress on the bones, and they react by getting more dense as a result, because the body wants to protect itself naturally.
Some other common reasons this can happen is you have some sort of calcium or vitamin D deficiency. That can happen as we age. Oftentimes we need to eat more of these nutrients because we don't absorb them as well. You can also have certain medications you may be on can cause bone loss. Obviously, your physician would know a lot more about that than we would. And excessive alcohol or tobacco use can also lead to osteoporosis.
Right. So none of those are particularly, eye-opening. I think a lot of people are aware of those factors, but if you're not, and there's other factors as well. We couldn't go through the whole list, but that's a good chunk of them. So, and symptoms. This is interesting because most people, if you have early stage osteoporosis, you will not have any symptoms. You won't have pain. You won't even know it. Is that correct, Adrienne?
yeah, there's usually no symptoms. And you may, be diagnosed with an osteopenia and have no idea that you have it. And osteopenia is just the beginning stages. So osteoporosis is more advanced, where those bones are even weaker.
Yeah, most people are very unaware they even have it until they have a big problem occur. So maybe you start having some more pain, stiffness, height loss is a really good demonstration of it, because as you don't have as much bone density, you tend to kind of shrink a little bit, and postural changes are common. Most people, unfortunately, unless you get tested regularly, don't know until you have a fracture, because something happens, you fall, you have more impact, the bones are weaker, they can break easier, or sometimes it's just a compression fracture if you sit more often and are kind of in that bad posture.
Yeah, and we're actually going to show a really good demonstration. We're going to step back in time. Bob and I use the spine, and we explain why just sitting down can create a spinal compression fracture in a vertebrae, which I've worked with a lot of people in that situation. It's very uncomfortable, and they do not heal real fast. It's weeks of being uncomfortable before it heals. So we want to avoid those with just sitting mechanics is what I'm trying to say.
Do you want to talk about some tests people can do, or what are common tests?
You want me to?
I can,
Yeah,
sure.
you're really good at
Yeah,
Are you
go for
familiar
it.
with the DEXA test?
Yes, I'm familiar with the DEXA. So it's just basically a scan. It's non-painful. You basically, I think typically they have you like lay on your back. But it's, I think, is it a form of X-ray, DEXA? I think it's a very low
Yeah,
form
the
of
dual
radiation.
energy X-ray
Yes,
absorbent. DEXA is easier just to pronounce, but yeah,
Absorptometry,
yeah,
yes.
yeah.
But essentially it just looks at, it's like a big picture of your body. And so they can look and see how much or how your bone density is.
Right. And then you'll get a score. We're not going to get into detail of the score. The doctor or the radiologist will get you the information to give you specifics. And they usually focus on the hip and the spine because those are the two areas where most of the fractures occur. There's a T score, there's a Z score. Don't get too lost about that. That's something that I would wait and get the information from your doctor. They'll explain it all in detail and what you need to know.
So I think we're going to go back in time to that clip Brad was mentioning earlier with Bob in it. So we're going to show that discussing vertebral compression fractures.
How we looking on that, Danny?
We're right there. Good to go.
Oh my goodness gracious. Excellent call.
A common way to get a compression fracture, which a lot of people don't realize. So here we got the spine. It's lined up. You want to show how it's lined up, Brad?
Sure.
It's lined up. You're in the right position right now.
Right.
So a common way to get a compression fracture actually is just to go ahead and bend forward like this and do one of two things. One, if you fell, that would put a great compression on the spine.
Yep.
Or two, actually, if you just lift something heavy and your back is in that rounded out position, just like that, you could develop a compression fracture just from that move. So if you're going to lift something heavy, one, you may want to rethink it, but two, you want to make sure you're in really good posture so everything's all lined up.
Sure.
So we're going to demonstrate in a second here why this bending forward like this can cause the compression fracture.
I also want to add another common one is people when they sit down, if they fall into the chair.
Oh, sure.
And older people, it's relatively common. They'll kind of plop into the chair, and that can really put some compression.
Yeah, they're in that rounded out spot. Now watch this. This is what happens.
Boom. Yeah.
And a lot of times the compression fractures happen right here where we call the hinge.
Sure.
And it's on these thoracic area here where they...
T11, T12,
T12, that's where we
L1.
often see it. So let's go ahead, let's say that's T11 and T12 right there, Brad. That's thoracic 11, the thoracic 12, the mid-back.
Right. Yep.
So actually we got T10, 11, and 12, wouldn't we? So we got three vertebrae here. And Brad's going to show you what happens when you go ahead and round out the back and you have weight on there. Now, that's what can happen. The bone can actually compress down.
So that's that rounding forward, and then you sit down and you plop, or just because the osteoporosis means that vertebra is weak, it doesn't have the integrity, and it's not going to accept this kind of force, and they just crush.
Yep. And sometimes they actually inject cement in there now to try to rebuild it up again. But it's, once it's done, it's done.
Right.
I mean,
it's not going to expand back out like our cushion here.
Right.
It just has to heal the way it is. And they can take, months. A lot of people are pretty uncomfortable for months. Usually a few weeks and they're getting better. But then we're working at not bending forward, not plopping, because that just re-injures it and re-aggravates it.
Yeah, so when
And we are back. We were talking to TikTok a little bit there. So
I got the spine from the old video.
That's the same spine, yeah, actually.
Oh.
So we do have some questions coming in. We'll answer before getting into some other parts of this video. So, does low-level rebounding count as hopping? Bonnie is
What's
wondering this.
rebounding?
Well, I don't know if rebounding counts as hopping. You want to show us a rebound?
A rebound is when you show me.
Okay.
A rebound.
Well, I'm not entirely sure
Are we
what.
just saying a rebounding like jumping down from something?
Yeah.
Oh, okay.
So usually a
presuming.
rebound, what I'm familiar with, is just a light little hop off a step and then you propel up again. And
So it's a second.
it's
the second hop.
You have a reaction
right. So it's
force.
like a drop and then a press up and back down.
So kind of like a plyometric.
Yeah, it's a very plyometric. And yes, I would say, I guess I don't know if it counts as hopping, but it is going to improve bone density. And there have been studies to show that. And I can't remember off the top of my head the height of the step that they recommended, but I want to say it was like 6 to 8 inches, which is like a typical step.
Now, this is a pretty high level activity. So someone who's 70 years old and may have osteoporosis, or even if they are active, I don't know if I personally would have someone do that at that age because it's pretty aggressive until I worked with them for a while.
Yeah,
or we had a T-score.
I would say if you have osteoporosis, do not start doing those things without some guidance from a physical therapist or your physician, your medical team. Absolutely. But if you are young and healthy and don't have any issues with your bones, that's pretty safe to start with. You might want to start with like some other activities to get you into it.
A lot of them are saying rebounding is like a mini trampoline.
Oh,
So that'd be hopping on a mini trampoline. You are still getting some.
You're getting some
impact
benefit.
Forces.
yes.
It's not as much as the ground because it's softer, but if it feels better.
And that might be helpful if
It might
they're
be an
comfortable.
easier way to enter into some of that hopping. And you are getting, I don't know what the forces are on a trampoline, but I would think you would get similar to walking. I would have to, I'd have to look into that.
And
I
it
don't know
depends
enough
on
about it.
the body mechanics of the individual. If they're a real strong heel striker versus a what we call soft knee or a forefoot striker, which most people don't do that, but some do.
Another question: does Pilates on a reformer help with osteoporosis? Typically, any form of resistance training will help as long as you feel like you're getting some form of resistance with it. It's fine. I actually had a podcast with a PT that only does Pilates with rehab too. Specifically, it's not all about osteoporosis, but it can definitely be used as a tool if that's something you like and enjoy. And also, what exercises should you avoid? We're actually going to get into that later in the video,
You
Diane,
bet.
so just stay tuned.
Right. I did want to, seeing how I had the spine here, we talked about the vertebra problems here, the compression fractures usually happen. You want to stand up?
Sure.
And turn, there we go. So right where the rib cage stops and the lumbar spine starts, usually in that area is a common place for the lumbar spine to actually collapse and have a compression fracture. The next most common place, okay, now I'm going to show this,
Sure.
is the hip. So a lot of people aren't really familiar with the hip if you ever don't look at an anatomy book. So the hip isn't the pelvis. The hip is the femur where it goes into the pelvis. And, it can be anywhere in this area that it may fracture. And it's typically from a fall. And you can see the hip sticks out quite a bit. And that's why it fractures in there. Usually there's no muscle here to protect it on the side right here. It's just strictly bone, unless it's a heavier person, they might have a little cushion there of fat. But that you fall on there, break, and then they're going to test you. But if you have real severe osteoporosis, you can actually fracture while you're walking. I was with a patient, I was working with a therapist, and he was walking down the hallway in a hospital, and she heard it crack. And down he went. It actually fractured while he's walking. That's not real common, but it is. It's possible that happens. So have you ever?
I've heard of that. I haven't experienced
Yeah.
it, but I have heard of just, the normal forces of walking can be too much for certain bones if they're.
And that's
they're
pretty
really-
severe.
It's a very severe
You're
case
right.
and it's rare.
Right.
A couple other questions before we get into some weight-bearing exercises to try. Do vibration plates help bone strength? A lot of the research is done on medical grade ones, which cost $3,000, not the $100 ones you can buy anywhere. So I can't say the generic ones are going to benefit you much, but I know the big, strong, expensive ones, there's been some evidence that it can definitely help with that. Next is specific exercises for severe osteoporosis. So some of these ones we're going to show, obviously, if you're unable to do them, don't start with these. We can link a whole program we had a PT do named Sarah Meeks. Chelsea can mention that in the comments. It's a whole video program with printouts. You can follow along. And that's more, I would say, very gentle and where you should start for beginners. It's very in-depth, and there's lots of videos to go with it. So
There's one exercise I'm going to mention right now that usually is not recommended for osteoporosis. However, it's a really good exercise, and that's swimming. There's no weight bearing with swimming. It's an excellent exercise, but you're probably not going to get it recommended for osteoporosis because there's no weight bearing. But I'm a swimmer, and I will do it regardless of the fact, because it's, other than that, it's great on the joints and great for the muscles. Do you have any input on anything like that?
On swimming?
No,
Oh.
not, unless you're a swimmer.
My input was watch Sarah Meek's method, because it's very much for beginners.
Yeah, she is.
I
She's
think.
been doing it for
She teaches
50 years.
Yeah, she teaches, and she has osteoporosis, so she can speak from a personal experience as well. Someone asked about red light therapy. I don't really know any research on red light therapy and bone density. I feel like because it goes so deep. I feel like you'd need a full red light bed for that, and I don't know if it would help, so I can't really speak on
Yeah,
it.
I don't know the research
I
on
know
that
there's a
either.
lot of stuff on superficial benefits from it, but I don't really know.
In other words, skin. And
Yeah.
not too much further than deeper than the
I
skin.
mean, I interviewed a person that had a lot of people use them and get good benefits in other areas, but that's anecdotal experience. He didn't really mention osteoporosis to my remembering thoughts, whatever. Words are hard when you're speaking live. Anyway,
Ugh.
let's get on to some weight bearing
Sure.
exercises people can begin with. Some of these may be easier than others, so just do which ones you feel are beneficial. And the first one is just walking. Just getting out and walking, if you are more sedentary, is very beneficial. Weight bearing. And then obviously make sure, if you don't walk a lot, to take it easy. Maybe develop a little walking program. Start with less distance and build up over time. If you're nervous about falling, make sure to use walking sticks, a walker, a treadmill, cane. Treadmill, if you feel safe holding onto the handles, you could certainly do that, and then other people will be around. But just walking is a good way to start.
Right. And if you want to do walking sticks, I'm a big advocate of them because they help your balance if you have any balance issues. And if you use them properly, which we have a video dedicated to how to use these and set them up, you're going to use arm strength, and you're going to get a little benefits in your arm joints and your shoulders, as well as the legs and the back and the hips. So again, better balance, little more calories being burned up. A lot of people are interested in that, and more benefits to the upper body. So walking sticks can be a great benefit. And if you can't walk because it's cold outside, you can just walk in place. We have some videos with Jordan.
Yeah.
Maybe Chelsea can put up some videos that Jordan has. She's been very popular, and she does excellent job with usually 15 to 20 minute in place walking. So you don't have to just stand there and walk and stare at the wall. You're actually following someone. You're going to learn something, to have a little entertainment with it. So that's a great option. Adrienne, do you have any other options that you do with people that?
I think, if you don't have access to a good place to walk, even just going to the grocery store or going to a local store, somewhere
Yep.
indoors, if outdoors is, like right now around here, it's slippery and icy, right? Although the weather's hopefully going to change.
Oh yeah, we've got a heat wave coming.
Heat wave's on
it's
its
up to
way.
20.
So
I'm on to the next exercise.
Oh,
Yep,
next
yep.
one, number 2.
Next one is just doing some sort of step ups or stairs. So just doing a step up. You can go all the way up the steps if you want, alternating. You can just do one step if you're limited and just leave it on there to strengthen it. You can also alternate it. Do whatever you want so you don't get too bored, but just doing some form of resistance training is beneficial because you're getting some strengthening going on as you go up and down stairs. Can be beneficial as well. Obviously, with some of these exercises, they're just going to be weight bearing like we're doing right now. If you are stronger and more active, you can certainly do stuff with weight on or any form of resistance training, because typically when you build up the strength of the muscles, it pulls on the tendons, which pulls on the bone, which helps with osteoporosis and builds up some bone strength. What are you doing, reading?
Yeah, I'm reading a comment. She has, Carol has osteoporosis. Anything to do to prevent it? And actually, these exercises in regards to activity and therapy, these are all good exercises. So we got 10 of them here. You can go back and look at these and you review them. Find out a few of them that work for you, and then start doing them on a daily basis or every other day to start out with. I like step ups because they're going to strengthen your legs. It's not only going to help bone density, but it's going to help your balance and your cardiovascular areas. So if you have a stool, I'm big on using something for balance. I personally use a stick myself, just like this. And they're just wonderful things. And just if you have a stool, make sure it's a solid one. Make sure it's very functional, and you don't have to worry about slipping off. And I'm going to ask you to
You
move,
mentioned
Adrienne.
step ups are great at any age. I do step ups in the gym on a higher step, and I hold a weight. So you can do them at any age, and they can benefit you.
So I like to use a wall, one hand here, one with a stick, and then your balance is very good. And like on this, I wouldn't go to the top one because why take the risk of falling? That's what we're trying to prevent is falls.
He
So
says I won't go to the top one as he goes to the top one.
well, I want to demonstrate, if I'm showing my daughter what not to do when she was young, I always did it first. I said, no, not that. So she's very clear on what not to
You
do.
must have burned your hand on the stove a few times.
Well.
Ouch. Anyway, the next exercise is sit to stands or squats, depending upon your age and what you want to do. If some people have good squat form, they can do squats. However, most people, if they don't work out, kind of have some funny form. So sit to stands keeps your form good.
Yeah, so a firm chair with firm armrests is really good, not a soft, cushy chair in the living room for watching TV. Push up with your hands as you need for balance and do 10 to 15 of them. If this is too easy, arms here, or you can push off of your knees. This is a little harder. I'm just doing a quick progression here. Arms overhead, even harder yet, challenges your balance.
Staggered stance.
Yeah, I use this for a patient
I'm hiding that
this
comment
week,
quick, sorry.
actually, the staggered stance. And
Why
this
do you do that?
One foot, the foot that is
It's
back has to
so
work a
hard.
lot harder.
Yep, it puts more weight in one leg. So you're getting closer to that single leg. So the leg that's back
Do a single leg.
is getting more force, but like having that other foot on the ground allows for balance. And again, doing it in a sturdy chair like Brad is doing, you could even use your hands to help.
Yeah, so if they're not ready for the
Right.
whole thing,
Or even just for balance, right?
Yes.
Just
and if it's still too hard, simply put a pillow or a cushion an extra inch or two makes a big difference. And you might be two.
yep.
So anything else that I interrupted and didn't?
No, I think that's
Influence.
good.
If that becomes easy, you can hold on to a weight and do it.
Yes.
Yeah.
We do. We have 70-year-olds do it at therapy sometimes.
Right.
Yep.
And-
I have people hold a weight here, and do the sit to stand.
You don't need to hold 30 pounds, but you can just do a sit to stand from a chair.
Yeah.
Or a box.
And start with a lightweight, but
Yeah,
you can
no.
add weight over
You can have a
time.
little dumbbell
Here,
or something.
start with the can of bubbler.
Okay.
It's 12 ounces.
You could just hold on to this and then do your sit to stands holding a lighter weight. Obviously, you don't have a kettlebell. You just hold. You want to give me that little dumbbell behind you, 3-pounders?
Yeah, that's
Sure.
pretty advanced. If you're doing that, it's good. And you're a healthy person.
You can just hold one dumbbell or two like this or like this and just
Mm-hmm.
do it that way for some resistance. Or if you have a weighted vest and it feels fine for you, you can try that.
I do want to show squats for people who do not need the chair, and you want to assure you're doing good posture with your spine. This is what I like to do. I use a stick. I use a Booyah stick. Any stick 3 to 4 foot long for this works. A cane would work. And I go right at my back, and I'll actually kind of rub my back for a little massage on those muscles. And I'll usually get my back to cavitate. In other words, it'll crack. Feels good. And then I put it in the crux of my elbow, put my palms down, and now I've got good posture. Does that make sense?
Mm-hmm.
And then I'm going to come down till my hands hit my thighs. And then I have a tactile, or I can feel how far down. So each time I go down about the same distance, and I can actually push up a little bit if I want. And that forces good posture versus, having this rounding the back. The Booyah stick is absolutely wonderful if you do this. If you have good shoulder mobility, touch here. Can you show where I'm touching, Mike? Or Adrienne?
Yeah, I'll show. So really, you want kind of 3 points of contact. So if you can, back of head, between shoulder blades, and then sacrum, which is hard to do.
I feel straight.
Yeah, straight as an arrow. And then you're going to hinge forward. And actually, you can let torso come forward, depending on, right? This focus is a little more on glutes to get that torso forward, which I tend to like just because it's a little bit,
Oops.
people tend to have weaker
But
glutes.
if I do this,
That's
my third point.
right. You lose that third point of contact on
Right.
the sacrum. So
So I want to be cognizant of that and make
Yep.
sure all three maintain. You know what I like about this?
what do you like about it?
Well, watch the bottom of the stick. And I'm going to do it with my posture up without hinging so much.
Okay.
I'm going to go down, and it touched. And that way I know how far to go down, so I'm consistent every time. It's one of those things that I learned it by accident. I thought, oh, that's kind of cool. And it forces good posture and consistent depth.
Yep, you get some nice
Yeah.
tactile feedback.
Oh,
That is
Mike.
nice.
I'm doing squats on the wall. 'cause
Excellent.
If you have a bad back, it makes you have good posture, and you
Yep.
can use the wall for support. You can just go down to what depth feels good for you. You don't have to go down too far. We don't want you to go down this far and you're stuck. So go down to what depth feels good for you. You can put the hands on your knees if you need to. You can hold them out. You can also use a little ball if you want to roll
Oh, there it is.
a little better on the wall. You can use a big yoga ball if you have one of those, whatever you have. And then you can just do them this way as well. Just a nice way to kind of do a squat. If you don't like squatting up and down, you can just do a sit too and hold. Not getting quite as much. I don't know. I feel like I get a good isometric hold here. These get sore after a while. All right.
Standing heel raises.
Yeah, calf raises. So we're going to focus on the calves now. So you can do this. It's going to be better weight bearing, so standing up. But you can certainly lean against the wall or hold on to a railing for support or something. And you're just going to go up on your toes and then down and go nice, slow, and controlled. So you can do 10 to 15 repetitions of this and just take your time with it. I would say if you want to build strength, it's good to go down slow. But if you want to get a little bit of that jumping impact, you can actually go down a little bit quicker on your heels because you're getting more impact forces going. So that's something you can try. Brad's talking. He's distracting me. Anyway.
No, I've got my mic off.
I know. You're still talking.
Oh, we were, Adrienne and I were just discussing on a commenter, Kelly, having T12 S1 and some problems there, laying down and getting up from a sleeping position, exacerbating pain, which is understandable, and how to eliminate that.
Talking about the log roll technique, right?
Yeah.
And so typically for the log roll, what I'll have people do is sit on the edge of the bed and lay down like this. Is that what you would have? What you would recommend?
Right. And then I'll give a verbal cue. I'll say, imagine there is a cast that goes to your trunk from your waist all the way up to above your shoulders, and it won't allow motion in your back or to bend forward, rotation, or back, because we want to stabilize the spine in a neutral position. So to do that, you have to tighten up your tummy muscles and your core muscles to do that without that imaginary cast.
Yep. And then you can roll, right? You're going to log roll and push up like that.
Right. So yeah, the log roll is like you're literally rolling a log. It doesn't twist or bend or anything.
Right.
So however you can visualize that, oftentimes helps people do it. I find
It does help alleviate pain for the back pain when you're getting up and out of bed.
And I've worked with people also as far as getting up from a chair, that tendency to go forward round the back as opposed to shoulders back, up tall, scoot your butt to the bottom or to the edge of the chair or the bed and push off if you need to, or get up with a straight back versus that unconscious. People, for all their life has gotten up with it, rounding their back and standing up, and then you have to change it. So it's one of those things to think about and do it slowly until you get used to it.
Okay, I'm gonna get back into strengthening.
Oh,
now.
yeah.
The next one is lunges. Now, there's lots of variations of lunges you can do. You can stay stationary. If you have more sensitive knees, you can certainly use a pillow or a pad beneath you. So that way, when you lunge, your knee isn't hitting with the hard floor. It's something nice and soft. And if you're really unsteady and don't want to go to this depth, hold on to something for support so you can get up okay. Maybe a countertop, maybe next to the sofa. Just make sure you have good posture while you're doing this and lunge down and then come back up. If you feel like this is really easy, you have no problems with it, you don't have to use support. You can even just do a walking lunge and go forward like this. Just take your time with it. If it's painful, don't go as far down, or you can even modify it by like starting on the steps if you want.
Yeah. And another thing with the lunge, since you saw a side view from Mike, is you want your legs to be kind of nice, like kind of in a wider stance, and then knees should go straight down towards floor rather than, doing kind of going in or out, which can be a common compensation. So just making sure you have nice, good form, your knees are in line with your ankles and your hips.
If you're really a beginner, you can, let's do on the steps over here. You can hold on to a railing and just put one foot on the step and then just start kind of lunging this way, because that way you're not getting as far down and you have some nice support. If you want to start with that way, you certainly can, and then just kind of progress from there. We already showed.
We can do some resistance training. So
yeah,
seated or standing.
Any sort of resistance training works well. Lifting weights, resistance machines at the gym, bands work as well. Any form of resistance is going to be beneficial for osteoporosis. Just make sure if you have severe osteoporosis, you don't want anything that flexes your spine too hard. We're actually going to go into some of the exercises to avoid in a little bit, but we can just show a couple generic exercises. And you can start with body weight with any of this stuff. So like push-ups, wall push-ups are fine too for upper body stuff. And you guys are just grabbing bands.
We're just grabbing bands.
Yeah, we're looking at loop bands. It's one of my favorite bands to use if you're at home and you want to do some resistance training, you don't have weights. And the thing about these, what happened to the dumbbells?
Someone's asking if barefoot is okay with these exercises. As long as your feet don't hurt, go for it. I mean, if you're at a public gym, they might not let you do it, but.
Yeah, I think that's all right. So, weights are good, but they're limited. I think you have more variety with bands, but you have to learn how to do it. And if you drop a weight on your toe, it hurts. And if you drop a band on your toe, it doesn't hurt at all.
But you could catch your toe on it and trip. So
that's true. There's a tripping
you get
hazard.
yourself in a tangle.
We talked about those squats before, and if you're doing well with those and you want a little more of a challenge, a loop band, this is one of my favorite ones to do, is use the band to offer more resistance.
Do you want to? I know you're tough, and you could use purple, but yellow might show up a little better on camera.
Oh, okay. I'm sorry.
It's kind of hard to see with the dark.
You want to try the yellow?
Yep.
Typically with bands, not every company, but most of them, the lighter the color, the easier. Sometimes it's not, so make sure to read the manual that comes with them.
And then from here, you can go here and simply do some side stepping. It's all weight bearing. You're going to get some nice strengthening, balance benefits as well, and also that bone density benefits. So, you can go into, we have videos for band exercises for beginners and advanced under Bob and Brad, and you'll get a complete, a 10-minute workout and explain how to use them. They work quite well. Good option.
Some other options of things you can do is any sort of standing yoga or Pilates. Obviously, be very cautious of some poses. If anything increases pain or discomfort, do not do it. You just kind of have to take your time with a lot of those things. And also,
I want to say one thing about, are you into yoga or Pilates?
I have done some, yes.
One of the things that you want to avoid is anything that rounds your back, and the fold, I believe they call it, where you go like this, touch your toes and try. You'll see people, the fold is where their chest and their face is right up against their knees. If you've got osteoporosis, you don't want to do that, because you have that compression problem with the vertebra, and you could actually cause a vertebral compression fraction from that. So I would avoid those extreme exercises with going forward and rounding the back. If you can do it with your back straight, you're not going to do the fold, and it's not what we want to anyways, and there will be people that will promote that, particularly younger people that aren't familiar with, vertebral fractures.
One last exercise before we get into more things to avoid, and that is stomping or jumping. So a stomp is, like an angry kid throwing a fit and they're stomping their feet. You don't have to be angry,
from
though.
Experience.
Yes,
huh?
I wanted that toy, But you can certainly start by stomping just in place. You can hold on to something for support if you want. You are in charge of how much force you're stomping with. It can be real light to begin with, which we would recommend. You can start with like maybe 10 stomps, and you can progress to maybe harder stomps as long as it feels okay. And you can start messing around too with like putting your foot forward and then bringing it back and stomping, because this is going to challenge your balance a little bit too.
Now, Adrienne, you've worked with a number of patients and you use this out there in the therapy world.
Yep.
You have any comments for people as far as precautions or things to how to do it properly or to avoid?
Yeah, I think the big thing is if it's painful, you're going to avoid it, right? And I think Mike laid it out good where you want to start with kind of a quieter stomp to make sure it feels okay. And then over time, you really want to get that foot, to be louder. And so
where will people experience the pain if it's a problem? Is it on the foot? Or is it in the knee, the
Sometimes-
hip, or all over?
Sometimes people can get it. I guess most of my people, it's usually the knee that limits them. But I would say it would be possible to get it in your foot, your hip, anywhere along the chain because the force goes all the way up.
But the first time you try stomping, I'm assuming regardless, you take it easy and see how it feels the next day.
I agree. Yep.
Okay.
And you're going to do less repetitions that first round, right? And I usually use this more so in patient populations with balance issues as well to train balance and to train that stepping reaction, right?
Sure.
To prevent a fall, which is also a good thing. We got to prevent falls for people if you do have osteoporosis.
We should mention if you have like very severe osteoporosis, you should hold off on some of the stomping and jumping stuff. This
That's
is more
correct.
for preventing it, or if you just kind of started noticing, you just diagnosed with it and it's not too bad. These are some options. The next one I'm already doing is kind of what I talked about with the calf raises, is I go up normal, but then I kind of just drop down. This is putting some sort of hard contact between my feet and the ground. So it's kind of the first step of jumping is just going up on the toes and then dropping down. So this is where you begin. You could certainly hold on to something for support with this if you feel unsteady or want to take some pressure off your feet. Just make sure it feels good before you start doing the next phase. Some of the next phase would just kind of be like little pogos, we call them. So notice my feet are coming off the ground, but very little. I'm not raising them up high. I'm just kind of pogoing. So it's like you're on a pogo stick. I think that's why they call it pogoing.
I think
Before
so,
you
too.
would progress to trying to do some jumping. And my shoes untied. Make sure your shoes are tied. But with jumping, I don't want to get into a whole lot in this video. We just released a video of like a few weeks ago on jumping, how to jump again for older adults. So if you're really into that, you can check out that video.
Yeah, maybe Chelsea
can
can
link
put
it.
that up, a link to that. That was a nice video. I wanted to mention a commenter said problems with osteoporosis and pain in the back, compression fracture. So it's a little more severe. And how do you strengthen the back if you're not able to do any of these impact exercises or things that are a little more risky with balance? I'm going to go on the floor for this. You can do this on the bed, but it's harder because your balance, and this is for back strengthening here. You'll want to work your range of motion and just make sure your back isn't really arched all the way and it's not rounded up. You're kind of in that neutral plane, and you tighten your abdomen muscles and you simply lift up one hand like this. And if you feel comfortable doing this, 5 to 10 times, and then you'll go to your leg. And I can feel my muscles around my trunk working. It looks like a simple exercise, but it definitely is working things when you maintain your stability in your core. And then the next part, this is a good balance and core exercise. You're going to need a nice carpeted floor or some pads for this because your knees may be uncomfortable for this. And on the bed, you can do it. But the problem with the bed is if it's soft, especially, it's harder.
Tippy.
Yeah, it's an unstable surface. So if all this is bothering you, it's just way too advanced. This is what I personally use. I use a ball just like this, and I just lie on it, put my hands out here, and people feel uncomfortable on a ball, but I've got my feet out and my arms out, and it's really stable, actually. And once you get used to it, you'll feel your back relax a lot. And I'm going to do the same exercises. And if you put your hand back there, when I lift this leg up, you can feel those muscles going to town and working good. So that is a nice way to do it. Opposite hand or hand here, if you get good at it, right leg up, left arm up. And that strengthens the back from the shoulder all the way down to the pelvis. And the ball is supporting your back, so you're taking a lot of stress off the spine and making the muscles work on the extensors or the back side. We have videos on this as well. They're actually a little bit older. But they're all there, and it's all good mechanics and good explanation.
Someone just asked if it's okay to do these exercises with scoliosis. A lot of with scoliosis is you're just going to do what you can tolerate and what feels good. Obviously, everyone's curvature and what they can handle with that condition will vary. So any strengthening exercises that you can tolerate and don't increase your pain would be safe to do. If something just keeps bothering it, then I would avoid it. I was told not to do deep lunges. I assume the stepping lunge is less invasive. Yeah, the stepping lunge would be quite as bad. If lunges just really bother you in general all the time, then maybe just stick with the sit to stands from the chair.
Mm-hmm.
It's not a single leg activity or as functional as a lunge, but it's still hitting a similar muscle group. So you could just do sit to stands instead of lunges if you have some issues with that. What core strengthening exercises? Well, the one Brad was just showing would be a good one to do, the bird dog.
Yeah.
And you can use them on a ball. It kind of depends upon your level too, especially with a T12 fracture. Just abdominal bracing, I would almost start with.
Right. Do you have some ideas for that one, Adrienne?
Yeah, I mean, you have to stay really neutral if you're having fractures, but I would say also like probably follow up with physician and your team and your personal physical therapist if you're having those fractures. Hopefully you're following up with a team that can help you. Because sometimes they recommend like literally you're in a brace after a fracture like that. And other times they may just have you, try to avoid certain motions and mechanics. So it really is pretty individual for those specific fractures.
Yeah, I know for core strengthening, if the person's advanced enough where they're comfortable standing, because we're going to go through some exercises to avoid with any kind, whether you have osteoporosis and a compression fracture or you want to avoid it. We're going to go through some of those, but I like using the bands for exercises that make your core work while you're standing. So it's very functional.
Oh, you're going to show that? Okay.
Are you going to do the...
I was going to do crunches on the floor, but you go ahead and do that.
I'm going to show...
I'll just sit here.
This exercise. Let me get a band here. Yeah, here we go. And you put this around something stable in your house. I know most people don't have a wall anchor like we do, but these are really convenient. You wrap it around, a handrail, a piece of solid furniture, or a doorknob on a door when you open it. And you're going to start out, you can just start out with like this and making circles here, and you tighten up your stomach and don't let your back make any circles at all. And right now, my core is working a lot harder than you might think. Also, exercises like this, keeping a good neutral core. In other words, you're not doing this. We're keeping a straight arm. We'll walk out till we feel some resistance, tighten up the core, and we're actually moving something. We're resistance here. And that's the same thing as when you walk up to a door and then you turn a knob and you pull it open. You're using similar muscles. On something like that, it would be something like this, where you're keeping your back neutral. So all these exercises with the resistance coming at a horizontal moment, the core is actually working without you realizing it, and it's functional. In other words, those are the same motions that you do every day for going up and down steps, opening the door, car door, whatever it may be.
Sherry just asked about Sarah Meek's method. We just linked it earlier in the comments, Sherry. She did a whole program with us you can watch for free. Some things to avoid is excessive spinal flexion. So flexion means rounding. You want to show what flexion is, Brad?
Flexion?
Yeah.
Oh, the spine. Yeah, we talked about that earlier.
Flexing, bending over,
Yeah.
rounding the spine like that. When you have osteoporosis, it can be very painful. Now, the crunch is a good core strengthening exercise. It does strengthen your core. But if you're doing this in a rounded forward position like this, like the old school sit-up, and you have osteoporosis, it could possibly lead to some sort of compression fracture. So it's just something you don't want to do. And that works with any type of sit-up or crunch. If you really want to do this exercise and be preventative, you can try Stuart McGill's method, where he normally has one knee bent, one straight. He brings his head towards the ceiling, but notice that only my shoulder blades are coming off the ground. I'm not rounding. So I have a nice flat back, and then I come back down. And I'm still squeezing my tummy muscles, work in the same area.
Oh, yeah, they're
but I'm
definitely
not.
hard.
Thank you. and you just kind of hold it for a few seconds and come back down. Notice I'm not looking forward either. I'm looking towards the ceiling. And then you can just alternate.
Do that
leg
again. We want to show
positions.
this gap right here is doing the work,
Yeah.
making
I'm
those work.
holding this right now. It's
Yep.
like really stabilizing me. I'm not rounding.
Yep.
So that's a safe way. It's just called a McGill curl up, I believe, is that exercise if you really want to do curls, but you could just do other core strengthening exercises like Brad is showing. Basically, you don't move your spine, you just stabilize with it. Toe touches.
Oh, we
We kind
referred
of
to
talked
this
about that with
before.
the forward
Yep,
fold
that
and yoga.
fold or whatever. We're not going to do those types of things. It's just not. It's not needed. It's
And
actually
then-
not advised.
Anytime you are reaching down to the floor to pick something up, don't do it with bad posture, because then you're going to have even more force because you have all this weight plus this. So you're going to have to either try to go down to grab something up like this, or you can certainly do. I don't want to.
Mhm.
Pardon me.
No
Or
problem.
you can certainly hold on to something to try to keep a nice flat back as you're picking it up, and then come up like this.
Right.
If you're going to pick up something off the floor.
And unfortunately, most things don't have a handle like that.
And
Like
don't weigh 30 pounds
yeah,
either. But
like a bag of groceries were a functional thing. And, that's where you want to, when you're at the store, if you're loading up your bag, don't put so much in there. Make less weight on the bag so you can grab it easier. You don't have to bend so much. Makes it easier to lift. So being aware of how you put things in your household, you're not going to be putting things in the cupboards way down low anymore. You're going to keep them at a higher level. You're not going to keep them way up here. So condense your working area so that your back is in that neutral position. So you might have to rearrange your whole kitchen. If you had a compression fracture, that's a really good idea so that you start working in that range where it doesn't stress your back.
we addressed this earlier in the show, but we keep getting more questions about it because people are tuning in later. Vibration plates. So vibration plates, research has been done on very expensive models, like $3,000 worth, not the cheap $100 ones you can find at any store. So I could tell you the good medical grade ones have some benefits. I can't tell you about the inexpensive ones. So
I have one at home right now. We're going to be looking into this more in the future.
are you going to develop osteoporosis first and then do it?
Yeah,
Oh.
no, I mean, as far as giving making your muscles work without when you just stand there, I think they're going to show there's going to be some benefits from it. I know you can use it stand on it, but I actually used it with my hands on it in a push-up position.
Yep.
And boy, did
use
that
them in
make my core and
stabilize.
shoulders work a lot. So it was a good adjunct to those exercises. So there's a lot of different ways to use these pieces of equipment.
Most of them you're going to get more benefit actually exercising on it, which is kind of how the other ones are marketed towards.
Sure.
Because a lot of them have built-in resistance bands.
In other words,
as well.
you're on that thing and it's shaking, and then you may put in some squats holding on to something.
or curls
Yep.
or
Mhm.
push-ups, or so you're kind of using it as an uneven surface. Definitely work your balance and strengthening. It's fine for that. I just don't know research. on it.
Adrienne, you said you've never been on one.
I haven't. Well, I've been on one. So one of the places I used to work had one, but I didn't use it a ton. One of the PTs there used it, and they used it mainly for people like with neurological conditions.
Sure.
Just to try to get those nerves to be more alert. So I don't know about osteoporosis.
You're right. Yeah, the
Um,
studies aren't there. I mean, to me, it makes sense that it would put forces through
Right,
the
it's
bones,
changing forces.
and it would help, but we don't know that yet.
A couple other things we'll talk about is oftentimes, like we mentioned earlier, is osteoporosis develops, people start to get some bad posture, oftentimes rounded forward. So some stretches you can try is Brad's famous W stretch for Wisconsin.
Yeah, so sitting in any chair, you simply up like this. It forms kind of a W, and because I'm from Wisconsin, that's what I think of. Or you can think of W. You're going to win. You're going to win some good posture by working the W's. You can do them seated. You can do them standing. You can go up to the wall. Use the wall to find out if you can touch with your hands. You might find out if you're contracted in a forward posture, and you might only get to here, and your arms and hands don't touch the wall because you're slouched and you're contracted or stuck there. So keep working on it, and over days or weeks, hopefully you'll stretch out so that you can touch your head, touch your butt and back, and get back like this. And my muscles are working right now, and I'm really getting a good sense of good posture. And do those, 3 or 4 repetitions throughout the day. You see a wall there? Go do the wall stretch. You're shopping, you see a wall, put your groceries down and do the wall stretch. People will look, but they'll know what's going on.
If you're like some of my patients and they said their wife has the wall decorated with too much crap and they can't do them, then close the door and do it in a door.
Yeah, actually.
Or doorway stretch even too.
Yeah.
Other options.
So yeah, we've got a lot of posture exercise videos, and particularly the ones for seniors will work a lot with some basic exercises that work well for that.
Do you want to show some balance exercises?
Well, of course.
Okay. Good job.
No. This is what I was thinking of.
Wow, you're just gonna cover the camera angle there.
Yeah, we've got to clear this. I forgot about this, but I'm going to be conservative. Some people will not need the wall, and other people's definitely will, because if you do try balance exercises and you fall, that creates a bone fracture, which you'll have if you have osteoporosis a little easier. So get in the corner, clear all the stuff out of the wall like
your
we just did.
spine and your
Yeah, take the pictures off the wall, whatever. And here I'm not going to fall backwards. I'm not going to fall to the right or the left. Forward will be the only thing. I'm going to use my Booyah stick. If you have a walker, put that right in front of you, or a chair. And this is a really basic pattern. Feet to shoulder width apart, stand tall. If you can do it for 30 seconds without wobbling, feet touching. Check yourself again, time it. See if you can go for 30 seconds and feel steady. If that feels stable, then go back to feet wide like this. Or actually, well, not wide, but we're going to go to one leg. Oh, everyone's going to be more challenging. What I'm going to say, for a lot of people, hands against the wall, one leg, that's not bad. Just put fingertips against the wall. See what happens when you don't put that stuff down?
Yeah.
And like this, and then go to one hand. And this may happen over a period of weeks for some people, or your balance may be to the point where this is all is challenging you enough. And do that with both feet. For people more advanced, it might be just fingertips on one side and you're balancing. Work for that 30 seconds before you go to the more advanced. The more advanced after this would simply be like this. And then for the really advanced people, like Mike and Adrienne, you're going to take a cushion. You might take something off of your furniture, just a cushion off your furniture, or a cushion like this. And that, if you can get down on my foot, that really you can see my ankle is really going to town. My ankle is getting stronger as I do this from the resistance of me trying to balance. My neurological system is being challenged. The strength is being challenged. And psychologically, it's like, oh, this is hard. But once you learn to do it, you feel better about things. Your balance will be better. Most people, I would assume in their 70s or above, probably will not get to this point. If you can get to 1 foot, in my experience in the clinic, I don't know what you guys, if I had someone 70, 75 years old, and I'd have them stand on 1 foot, if they could go for 5 seconds, that was pretty good on both feet. Some people can do it easier, but so
it's a hard skill. It really is.
It
hard.
is. And if you don't feel comfortable with it, don't do it by yourself.
Right.
So is there anything else we want to talk about, or just take some more questions and kind of wrap it up?
Yeah, and if your walking's not that good, you feel unstable with it, you don't want to go out because you're going to get tired, you need to sit, get a 4-wheeled walker that has a chair in it so that you can sit down when you get fatigued. Make sure you learn how to use it. But, don't allow poor balance prevent you from walking. If that's all you need is a cane or a walker, I would probably, talk to your doctor and see if you can get a script for a therapist just to get everything set up properly, show you how to use it. And in one visit, probably all you would need for that, just to make sure
you're
to
set up your walker. Yep.
Yep. We've all done that with many people.
So someone wants to know about a back cushion for good posture when sitting. Oftentimes, I just take a throw pillow and put it in my low back, and I've never been happier. If I'm being honest,
I'm going to walk in front.
You could take a throw pillow. You could take a long pillow. Specifically, if I have a good chair like this that's sturdy, I'm normally fine. Or if you have a lumbar
Wanna get it
support,
fully
most
funded.
modern cars have a good lumbar support. Most higher quality computer chairs have adjustable lumbar supports too. But I always find it in the soft recliners or the soft couches, you just sink and you're like this, and then my back hurts. So
Yep.
I just fill it in with a pillow.
Yeah. And my recliners that I've used, I got a different recliner now that has really good lumbar support that's adjustable. But most people probably won't have that. A small throw pillow. But if it's a really firm one, it might feel like a big bump and you feel like this. If it doesn't feel right, it's too much. It should feel comfortable.
Mess with different sizes too, because some are round, some are squares, some are thicker, thinner.
Yeah.
So just try different ones. And then, I mean, McKinsey sells back lumbar rolls if it's your low back. You can also do a rolled up towel as an option too.
I wanted to say, Mike mentioned, if you take a regular pillow from your bed, I just learned this a few years ago, and it's like, I am amazed how that feels really comfortable. And have you done that, Adrienne?
Just with a pillow.
Just
yeah.
a pillow, yeah, vertical.
Yeah.
I've always used a lumbar roll or a smaller pillow, and then it's like Rick Olderman said, try this.
Especially
and
if it has a really deep seat pan, or
Yeah.
if the couch goes like the depth of it is a lot and you're a shorter person, that can really make a big impact on that.
Yeah.
Your body's different, your chair's different, so you have to do a little experimenting and
Right.
find out what works for you.
But
as an
that up and down
individual.
pillow, I use a lot when I work in the hospital. And so we're constantly positioning people
Oh,
and helping them
sure.
with their back pain.
Yep.
And that's a really good one
Yep.
that we use.
If you're watching this live, it'll stay on. I'm off. Yeah. Oh.
Mike just turned off. That's enough for him. You don't have to listen to him. Oh, so for 30 days on Facebook, this video will be available. On YouTube, it will be available for quite a few thousands of days. Is it indefinite? I think on YouTube. And you can repeat and go back and forth to catch information that you may have missed earlier on. So that's a nice benefit. And we do keep track of people that watch during the day when we're here and then over the next few weeks to see how things are coming along. So put comments in there, even if you're not going live, and we can look at the comments afterwards, weeks afterwards.
We'll be live next week at 10 a.m. Central Time, talking about foot pain and plantar fasciitis.
Someone did ask about the shoes. Does everyone here have wide toe shoe boxes?
Yeah, we both have ultras on.
Yeah,
right
Mike
now.
and I.
So do I.
ALTRAs,
Well,
and you
mine
got
are Merrills.
Merrills.
Yeah.
But
so
yeah, we
wide
all
toe
have.
boxes.
So
Yep.
we'll talk more about that more in detail next week. Their ultras in these Merrills are kind of on the expensive side. People who maybe run and stuff. So you can get cheap. What do you use? Witten? Are the cheaper ones?
Witten are the cheap and expensive
W
ones.
something
Yeah,
EN.
WHITIN. Anyway, thank you for watching, and we'll
thanks.
be back next week.
Yeah, be careful.
Adrienne, join
Keep
us.
your back and spine and your bones strong and healthy. Strong like bull. That's what I always say.
Not Bowl and China Shop.